So today I'd like to talk about insulin. So insulin is an hormone that helps to regulate blood glucose levels for people living with diabetes. Now you have various types of insulin. So insulin is normally made in the pancreas. So as I said, you have various types of insulin, but today I'd like to talk about a mixed insulin called Humulin M3, often used in the UK for a patient living with type 2 diabetes. However, you may see some type 1 patients on twice daily mixed insulin on the advice of their consultant. Now, this is a demo pen that we normally use to show patient in terms of how to administer their insulin when starting on insulin. But this particular insulin, it is very cloudy in here. So when taking the insulin, it is important that you mix it properly by rolling it and gently shaking to make sure that you don't get the fast acting bit. So Humulin M3 consists of 30% short acting and 70% intermediate acting. So that purpose is to help in terms of your meal time and in between meal to help regulate your glucose levels. So this insulin has got a onset of 30 minutes, meaning you need to give your injection, whether it's before breakfast or before dinner, at least 30 minutes before. It's got a peak where it's very more effective as 2 to 4 hours and lasts in your system for 12 to 14 hours. Even though this insulin is just administered twice a day, it is important to understand that you must always have breakfast, lunch, and dinner, because when you take the insulin in the morning, it is still running throughout lunchtime and up until your dinner. The twice daily injection gives you a 24-hour cover. So it's important that when you're on insulin, to stay safe, you always need to make sure you're checking your blood sugar. Make sure you know the timing of your insulin, meaning before you give the injection, and make sure you know how long it lasts. So stay safe, and look after yourself and management of your diabetes.